And then we've got our mentees who are part of the group. So just to show you the membership, it's a big group with all the big guys there. So we get guidance so regular, and sometimes as the co-chair, sometimes we are guided. Thank you. And so these are the members. In terms of our objectives, our objectives are to develop early career mental health researchers. We're doing that through, at the moment, we do have a mentorship program that Laila is going to talk through. And then we are also working actively through collaborative research projects. We're looking for funding, and I do understand that we have potential funders here. We need money. Research needs money. You can't do without money. And I think we are all money, so please, let's get money, put it in the basket, and then we work through that. And then we also wish to get some money to provide opportunities for sharing that research and progress. So we are going to present, the three of us are going to present, so I'm going to call Nduku to come through and talk through some. I'm going to call Laila to talk through the goals, and then so the three presenters in this group. Thank you very much.
Yeah, so we know if you want to go fast, go alone. If you want to go far, go together. But this has not always been an easy thing, especially for our research working group in meeting the second aim, which is collaborating on a research project together, especially when you have, different research interests, competing obligations, and then also just having to figure out a topic that's relevant to the continent at large, and also answering, also for it to be aligned with the AGMHI objectives. And so developing a research project around this year's theme really was just a low-hanging fruit that enabled us to be able to put something together and work on something together as the working group. And it also presented an opportunity for the working group to support early career researchers in terms of just building their capacity. So our current project, it aims to explore the perspectives of healthcare professionals in regards to innovative approaches or interventions that are available on the continent. And what we are doing is really looking at the insights on perceived effectiveness of these approaches for the prevention, promotion, and the management of mental health problems. And we also want to explore, aspects of scalability and sustainability of these innovations within our context. Our study is focused on 3 areas, which is technological advancements, alternative opportunities of support, which are your community-based interventions, as well as peer supports, and then also looking at policy and funding, which we know is neglected and yet critical on the continent. And as Prof. Laila has said, it's being led by the early career researchers. So that's Claire, that's Benita, Tigist, Selamawit, and myself. And we've been supported by Dr. Sarah Kiburi and oversight by both Laila and Dr. Munya. And so our study is using a mixed methods approach, so using both qualitative and quantitative approaches. And our idea was really to make the Congress more collaborative, more participatory. And so we are inviting you as the participants, whether you do clinical work or not, just to fill in our survey, and also to put your hand up to participate in the qualitative interviews, which will be facilitated by the mentees. And our hope really for this is that it will give us insights that can inform the work the AGMHI is doing and help us address other knowledge gaps on the continent. So yes, we're inviting you to participate in the study. There's the QR code on the screen, and it's also on the back of your booklets. And if you do want to support in any way or just, come on board in this project, please, you can reach me on nduku@wambua@ari.org. And yes, thank you.
So everyone, just a reminder, look in the very last page, your very last page of your booklet, and that gives an overview of the study. You can just click on that QR code and you can fill it in anytime. It's really important for a couple of reasons. One is I think we need to support this amazing initiative from our early career researchers, but also for a conference, I think it's in the spirit of the AGMHI that it needs to be collaborative. The learning needs to be bi-directional. So it's not about us or senior people just standing in front and talking about innovations. We want to hear what's happening on the ground as well. So it's a great way to bring some depth to the conference as well. Our final goal that I'd like to talk about is a grant proposal that we call Core MH that we have been working on for the better part of this year, and I think a bit of last year as well. And it's really kind of links to the other goals that we've been working towards, and that's really about strengthening capacity for research excellence in African mental health. So what's the foundation of it? The foundation of what we've done and kind of the piloting of what we've done has been the mentorship program that I've spoken about. This resource hub that the other work groups have spoken about that's slowly been populated. There's a UKZN Research Week that most AGMHI members know about that's held annually at UKZN that's available for people to attend in person and online. And the fact that we're trying to get active early career researcher involvement in our working group and in others. And so what we're trying to do is to scale and refine our proven mentorship and training model. And we've decided to focus specifically on pre-doctoral researchers. I think the thinking is from focus groups that we've had within the AGMHI that once you're in a doctoral program, there's a certain degree of support, right? That happens. It may not be great in all institutions, but there is a degree of support. The challenge is getting into a doctoral program when you have that interest. And so the goal is to build a sustainable pipeline of skilled researchers through structured training, mentorship, and career development for pre-doctoral researchers. And what we're looking at for this research program is 2 tracks, an intensive fellowship tract and a broad-based tract. The intensive fellowship tract, it's a 2-year fellowship program. We'll take in 4 to 5 intensive fellows every year. And those 4 to 5 fellows, similar to how we took in the 4 to 5 mentees, will have directed training, funding, mentorship opportunities, and hands-on research opportunities. For the broad-based training, there'll be within them a professional development series where people can attend live workshops, so standalone workshops and seminars that they can get certification on. And there's also the ability to access a resource hub where there's accessible on-demand learning. So this is what we're talking about. We've got our intensive fellow program and our broad-based training. The broad-based training has a professional development series and the AGMHI Research Hub. The training core has 5 components. The intensive fellow program will engage in mentorship. We'll have a transparent selection process around how these fellows are selected. There'll be mentorship coordination like we've had with FADWA. There'll be very clear deliverables, very clear milestones, career development plans, and milestones along the way. Then we will have a fundamentals of research core, and the basis of that is the UKZN Research Week, where we have a very clear program to that. There's formal training, and there's also an element of a writer's retreat. for peer support, networking, presenting preliminary research findings, meeting with other research mentors beyond your one-on-one mentorship. Then we will have a biostats and epidemiology core led by, where is Dr. Akena? Makerere University, along with his team, that will firstly include a foundational epidemiology and biostats training for our core fellows, and also an online element for our broad-based professional development series. It will also have individual statistical consultation, so the fellows will have a research project, and then we'll be able to call on Akena and his team and say, this is my project looking at dementia in Tanzania. It's a cross-sectional study, and then they'll be able to engage with the biostatistician. Why did you choose cross-sectional? Why did you not look at a cohort study? Let's look at the pros and cons. This kind of in-depth discussion around biostats that's so difficult to get, and it can all be done online. In addition to that, for the broad-based training, there'll be seminars and an AGMHI resource hub. And then for neuroethics, where's Prof. Angela? There we go. Prof. Angie, who is a legend in her own right, together with Dr. Olivia Machabane. Olivia, there we go. Both phenomenal neuroethics, have both phenomenal neuroethics expertise, have put together this neuroethics core. And the minute this landed with us, we thought this is an obvious thing on the continent. Of course, our challenges are unique and interesting and worth grappling with. So again, our intensive fellows will be able to meet one-on-one with our leaders, and we'll be like, okay, what are the challenges in your research project? Let's grapple with it. And what an amazing opportunity that would be. And they'll also have foundational training, which will be available to the fellows, but also broad-based training in terms of seminars. And we're also really excited to join on the podcast train. How amazing it would be to have case studies where senior researchers and clinicians talk about neuroethical dilemmas on a podcast that's accessible to anyone. We've tried for the AGMHI Resource Hub and the Professional Development Series to get a balance between online resources that are very snazzy looking, like videos, but also things like podcasts and written material that people don't have to use a lot of data to download. Finally, and what I'm quite excited about, is a funding opportunity for the intensive fellows. And that offers them research training support of $10,000, up to $10,000. So what these fellows will do is they will work on a career development plan in the first 6 months with their mentees, with the mentors. And then they will say, I need money for my research, but I also need money to go to visit University of Ghana to see how they do things in a clinical trial that I think is really interesting in the faith healing camps. I would also like to go and do a qualitative research course in University of Zimbabwe. And it will just give people the space to use the money as they see fit, which is something that's so rare for early career researchers on this continent. It's always being dictated to how they use their money. So together, obviously, with guidance from their mentors, we'll be able to give them the space to use the money as they see fit. So what is unique about our proposal? We're focusing on the pre-doctoral emerging researcher. We really want AGMHI community development of our proposal. We got it at our conceptual phase. We want it at our refinement phase, which is right now. And we want it at our implementation phase. Our funding model that I mentioned of the $10,000, I think, is quite unique in how it will be used. It really is a scaling up of pilot projects that have been successful, including the UKZN Research Week and the mentorship. It adds an additional neuroethics core and a biostats epi core that's unique. And it has a range of accessibility options, in-person, virtual, live, podcast, and written. So the question is, how can you get involved? So you can serve as mentors if you're senior for fellows. You can provide career development lectures, for example, on how to manage research funding, how to do an oral presentation, how to put together a CV, etc. You can host fellows within your own research project. If you've got some nice data, please host them. And importantly, for this time, you can offer feedback to refine our content. So really, it's very nice to get a pat on the back, but it's even nicer to get a solid critique. And that's what we're here for. So we've got a few minutes. Please, critique is great. And feedback. Thank you.